Dr. Janish Kothari, thank you so much for being with us on ITV Gold again. It's great to have you here joining us. How are you doing today?
I'm doing great. How you doing? Glad to be back here again. Hopefully we can catch up from where we left off last time.
Definitely. There's so much to follow up today. We'll be addressing a part of this interview in our news segment airing later on tonight. I just wanted to start off this interview sort of looking at the current number of cases that we're having here. We're looking at over 1 million cases in the United States and more than 59,000 deaths. Still a very large number and very alarming. So I just wanted to begin this interview asking you, how do you process these numbers right now? And how should we sort of look at it, when considering the flattening of the curve?
I think that's a great question, and there's probably two ways to look at this one. And on one hand, the number of people that are afflicted and consequently the number of people that have resulted in death is bad, and it's, no matter how you look at it, right? It's sort of what kind of makes us human and all of this, because all human life is precious. On the other hand, being practical in all of this and kind of understanding that we were going to be affected with this in one way or the other. These numbers are significantly less than what we had initially anticipated. When the preliminary kind of numbers came out early on, like maybe 5-6 weeks ago, the initial projection, at least for the United States, were that we're going to hit somewhere along the 100 to 200,000 death mark. And I mean, we're close to like 60 right now. We don't know where the end is right now, but at this pace, we're sort of a lot less than what we had anticipated. So that's something that's a little bit of a positive.
Is there a decline in number of cases as certain governors of certain states are saying?
I think that there is a flattening of it. There's still the amount of people that are being like coming into the hospital, it's kind of flattened out. I remember initially every day there'd be a significant amount of people coming in, and we would have anywhere from 30 to 40,000 people being tested positive on a daily basis. That doesn't necessarily mean that they're coming into the hospital.
Right.
So we've kind of seen a decline in that. I wouldn't say that it's been that drastic, but I can definitely say that the amount of people that are being admitted to the hospital has sort of flattened out. We haven't seen that peak that we were seeing earlier on.
Let's talk about the virus itself real quick. Have there been any developments in exactly what's happening to the virus and what is exactly that it's doing to the body? Since we are seeing such a huge increase in number of cases and number of deaths, what are some of the developments that you have found lately?
Okay, that's another really good question. So the knowledge and understanding that we have of this novel virus is changing rapidly, and every day we're learning something new. And it's really hard for like the common person to sort of keep track with this stuff, and it gets a little confusing. And what we do know that this virus causes a respiratory tract illness, and it can range from a common cold to a potentially life-threatening respiratory distress syndrome. The initial reports had compared the virus to influenza, and they said that there's certain similarities. And earlier on in the disease course, we quickly learned that there's not a lot of similarities to this, and in fact, that this virus is far more lethal. The initial projections had said that, well, not the initial projections, but what we know about the flu is that on an annual basis, it causes mortality in about a little less than 1% of the people that are affected. But it affects a significant amount of people, hundreds of millions. So if you take less than 1% of that, it's still a good amount of people. And this data was presented by the New York Times. And although it's unclear at this time, the death rate from COVID-19 appears to be much higher than that. They looked at some of the evidence from Wuhan, China, and some of the different provinces within China itself. And the death rate at that time ranged anywhere from like 1.5% to as high as 15%. And we haven't really conducted our own studies along those lines, but what we have noticed is that the virus is affecting people based off their location, their ethnicity, age demographic, comorbidities, the length of hospital stay required. There's a recent article that was published by a medical journal called JAMA Network, and they basically gave alarming statistics saying something like those patients that are ventilated, having to have the tube inside of their mouth, there's about 88% mortality in these people. So it's really hard for us to say, hey, anybody that gets this virus, there's a mortality rate of 5%, because there's so many subsets of the patient population that's affected that are responding differently. So it's really hard to put one number on it.
So, when accounting for that, how would you address another occurrence of this virus? Dr. Anthony Fauci actually said that the second round of coronavirus is unavoidable. Could you reflect on then how much we have to be concerned about this happening again while you're still dealing with such a high number of cases on a daily basis?
Well, there's absolutely a concern for recurrence, and in fact, I think it is also inevitable. I frequently find myself having this conversation with my friends and colleagues alike, and yes, the numbers are going down or sort of kind of plateauing, but this does not mean that the virus is going away, We still have no cure. And vaccine, or we don't have a cure or vaccine or any truly tested option that's currently available. And the only major dent that we've been able to make in this whole process is the conduct of social distancing, And so right now, all we've done is pretty much put a Band-Aid on the bleeding. And, the minute we open up the economy and retract the orders of social distancing, the virus is going to be able to find new hosts to infect. And, we very well may see another wave, and perhaps this wave will be a little bit more robust than the initial wave, And I always remind my patients and my family members and patients' family members and anybody that I speak to that's not in the medical community that the virus has not gone away just because the numbers are going down. And it's pretty much merely waiting for more hosts to find when they decide to finally come out of their homes when it's time.
Wow, so this kind of brings me to one of the most important questions that we are nationwide discussing it today, reopening. As you and I are speaking from New York City, which is the epicenter, some states across the country are applying to reopen or are reopening right now as we speak. What's your medical take on, the requirements for reopening? And when we're looking at a location like New York City, which is the epicenter where you're also working, is reopening really something that we can consider right now while we are coming towards the month of May?
So the idea of reopening is an interesting topic, and there are people on both sides of this line, and it becomes very difficult to kind of pinpoint which is best. If you talk to a medical personnel, they're going to tell you that, we're not ready yet. If you talk to somebody that's not in the medical profession, who owns a store, who can't, provide money for their family to put food on the table, and they have to pay their rent because they own a shop in New York City, they're going to have a completely different take. And then you look at people from different parts of the country, somewhere in Idaho or Iowa, compared to somebody in Los Angeles, Seattle, and New York, who have been afflicted a lot different. And to kind of have these social distancing and quarantine orders across the country, you can't really compare everybody from these different places and treat them similarly. But for me, as a medical perspective and working in New York City, one of the, if not the most afflicted place in the country, I think that the states that are beginning to kind of ease these stay-at-home restrictions, none of them have met the criteria that the government has said that they need to see a steady decline of 14 consecutive days of people that have been testing positive, and nobody really has met that,
Right.
And I think that we're thinking about this pretty much in the wrong way. Everyone wants to know when we're going to be able to open and leave our homes and, kind of go back to what the world that we knew. But I think the better question is, how will we know when the country is ready to be open? Not when. Because any of the dates and stuff that we currently have, they're just kind of being thrown out as guesses. It's being kind of pulled out of thin air. Nobody knows. The virus is still rampant. But I do think there are certain measures that can be taken before we sort of begin to reconsider opening. And one thing, yeah.
Sorry, go ahead.
But one thing I would say is that the states that decide to open, the hospital must be able to safely treat these patients, because we saw that we kind of weren't able to treat the people that were being affected. And that's when we had all this crisis amongst the personal protective equipment, ventilators, and all that stuff. So states shouldn't open if they haven't rectified those situations. The states have to be able to test everyone who has symptoms. And we have to be able to conduct monitoring of the people that have confirmed cases and the people that they come in contact with. And they have to have a steady decline of consecutive 14 days of people being tested positive.
Dr. Kothari, this kind of brings me to a very important question that everyone is asking, which is, how much of this is dependent upon testing as well as then getting some more treatments out. Today, a huge, pharmaceutical giant in this country, revealed that there's a positive data in study for potential COVID treatment. It's an antiviral drug, and then we're hearing other medications, other treatments. So if you could reflect on what this is going to be based on and also what's happening in these treatments, I think that'd be really great.
Right. So the company I think you're referring to is called Gilead. And even when we spoke last time, there was a medication that was out called remdesivir. It's an antiviral medication that's been used for other conditions in the past. And at that time, it was gaining some headway about being a potential treatment for this disease. And actually just today, they released some preliminary results about coronavirus, which showed that about 50% of the patients that were treated with a 5-day course of this drug, they showed some improvement, and more than half were actually discharged from the hospital within 2 weeks from their admission date and from when the drug was started. But you have to take this with a grain of salt. This was a single-arm study. And for those out there that don't know what a single-arm study is, that they really only just looked at the drug in these patients. They didn't have a control group to compare to patients that also had COVID-19 who did not get the drug. So it's really hard to make a comparison between the two because you have to, match up a lot of the data to make sure that the studies are even on both sides. But with any clinical trial being run in the light of a pandemic, time is of the essence, and it would be impossible to sort of expect this type of study to be conducted. What Gilead was able to do is to make a conclusion that a 5-day course seemed to be better than the 10-day course in terms of outcomes, side effects of toxicities and things like that. And actually FDA, there's some chatter among the medical community that the FDA will actually approve this medication for emergency use in certain COVID populations.
Right.
And the other thing I think is my hospital actually started enrolling in this study too. So we're going to be actually giving, it just happened today, so we haven't started it yet, but we're going to be giving this medication to a certain subset of population based on the guidelines given by the FDA, just to kind of make sure we, stay up to date with what the expectations are. And hopefully we'll have some more information about that.
And is there any update for vaccination? I know this is a long process. Many doctors have told us that, but do you have any current updates on it?
So U.S. health officials say producing a vaccine to prevent the disease will take anywhere from 12 to 18 months. So this has been going on, I guess, since December. So, we're not really that close yet. But this is what makes finding an effective drug treatment sooner even more crucial. I think this is why so many of these smaller studies and trials are gaining headway. It's because of the sheer need and want for something, like anything that we can use to help these people. I think this current climate does shine some light on the importance of vaccinations. And, I know a lot of people have some misinformation about and fears about vaccinations and their rare side effects and potential poorly supported claims. Right. So I think that a vaccine is pretty much the only way we can kind of eradicate our fears. Right. And if these vaccines are kind of proven and all the data supports that it'll work. But unfortunately, there's no timeline yet as to where we are going.
Right. And in terms of testing, Dr. Kothari, we are hearing so much in the news about antibody testing and also, more testings to just see who is COVID positive. What have you seen around, your own hospital experience in terms of testing, and also any insight into antibody testing and what we should know about it?
So earlier on, when this whole thing started happening, we had a limited availability of testing, and we were only testing people that were highly suspicious. And even then, the tests aren't that great. They were only about 67% accurate. So which means that even if you got a negative test, that 33% of the people you're still missing. So a lot of times we had to retest people because we were like, this test is negative, but this patient fits every symptom, So we had to do that. And so we were using these tests very judiciously. But now, over the course of these weeks, the testing has now been widely available. At least I can't speak for other parts of the country, but at least in New York City, we have an abundance of locations where people can be tested. Local pharmacies such as CVS, Rite Aid, they're having clinics that are opening that are available for people to use.
Right.
and urgent care clinics, emergency rooms. So people are having access to that. And they also recently just released antibody testing, which is a blood test that you can see that if you had a history of symptoms, or even if you weren't tested and you wanted to sort of find out if you had the virus and if you mounted an immunity to it, you can test for that. And that's actually very important because that offers a potential other form of treatment to people that have recovered from the virus. They can offer up their plasma, which is a component of blood, and
Right.
this is a component that contains the antibodies that can also be used to be donated to people that are affected. And that's something that we've also actually done at my hospital.
Wow, I think that's very interesting, and good luck to all of you doing antibody testing. I think it looks very promising. Also, in terms of critical care and patients at high risk, have you seen any involvements in COVID relations with either heart diseases or other issues such as high cholesterol or diabetes? What should we be aware about right now, since there has been more number of cases as well as more research done on what COVID is doing?
So the last time we spoke, I said that I particularly saw a rapid decline in admissions to the hospital for other medical conditions that were pretty much the staple of my practice. And within the hospital, heart attacks, high blood pressure, uncontrolled diabetes, and boy, was I wrong. What we noticed that people were not coming to the hospital because they were scared of picking up the virus in transit within the hospital from a roommate or somewhere in the ED from the physician themselves. So they pretty much sat at home, letting their underlying conditions worsen. There have been a lot of reports about people being found dead in their homes from heart attacks because they didn't come in, even though they had typical signs and symptoms of chest pain that would indicate a heart attack. Some people that eventually came into the hospital were found to have severely elevated blood sugars because they ran out of their diabetes medication. They couldn't access their insulin, and they were too afraid to go to the pharmacy or their primary care doctor's office to obtain another prescription. And my advice to these people that are still with us, and the people that do have these underlying conditions, is to continue to take their medications and operate under the assumption that their medical condition is still as of significant importance as any other patients, or any other medical condition out there. And they should reach out to their primary care doctor and come to the emergency room with the appropriate protective equipment that they're operating with when they go to the supermarket or
Right.
however, to protect themselves. Because I think that a lot of these other things we can prevent. We can save lives. We can fix heart attacks. We can control high blood pressure. We can fix diabetes.
Right.
So I think it's important to kind of find the balance between that.
This brings me to asking you about how are the hospitals doing right now? Since we last spoke, there have been massive changes. I know PPE is an increase. There has been a huge national discussion about what hospitals need, hospitals over capacity. But what is the condition right now? And what is happening in critical care in terms of taking care of patients and also taking care of COVID patients?
So I think that this question is likely answered with variable responses depending on who you ask and where they practice. My current hospital in pretty much the heart of New York, we do not appear to have any challenges at this time in terms of personal protective equipment, ventilators, dialysis machines, doctors, nurses, respiratory therapists, the ability to treat a number of patients. We have the available beds. Our administration has done a pretty good job about, of listening to all of our requests and planning for a rainy day, so to speak. I've spoken with other physicians across the country and frontline workers at, different institutions, and some of them have been using their N95 mask for upwards of 3 weeks, and there are nurses that have walked into the hospital, they get one gown and they get to use that for their 12-hour shift, and so there's certain other people that are dealing with that. So I could think that's really much just institutional based. And it's also really nice to see that there are third-party vendors that have just actually donated a significant amount of stuff.
Right.
At least from my perspective, we had thousands and thousands of masks donated to the point where we've actually told them okay, we have too much, just give it to other people across the country because, we don't even have space to keep all that stuff now. So we're actually very fortunate and blessed, I would say.
You know,
And
um, And also, just you're talking about donations, there is, this huge, a movement for helping doctors and, feeding doctors of America, where, many organizations are donating food. I know your hospital and you personally have experienced that too. I would love for you to highlight that as well.
This is something that came out of nowhere. Nobody was anticipating this. And amid all of this, we've all been truly humbled by the generosity from many vendors across the nation, particularly in New York City. So many of the local restaurants and within Brooklyn, where I live and where my hospital is located, they've donated food to us on a daily basis. For about the last 6 to 7 weeks, almost every meal has been provided: breakfast, lunch, dinner, sometimes snacks in between. And coffees and like chips or whatever, protein bars, like fruits and vegetables. People just been donating so much, and I think that it just shows the way the public is trying to respond. They see that, the physicians and the healthcare people and frontline workers within the hospital, they're doing their part, and whatever little bits that they can do, that they're trying to play a role as well. And it's really good to see this level of camaraderie.
Right.
And the other thing I'm not sure if you've noticed, but at 7 p.m. every day, the entire city just takes a pause for a few moments to go on their rooftops or stand in the middle of the street just to simply like clap and cheer for healthcare workers. And I remember, like, when I got into this whole thing, I never did it for that sort of response. I just genuinely wanted to like help people. But when I see people doing this kind of stuff, it brings such gratification within my heart. And it just reminds me that there are actually people out there that value the work that we do. And like kindness is not lost in the midst crisis.
Right. This has taken a huge toll on the medical community of this country. We say, they're the frontline heroes right now. They're saving lives. They're taking the toll of everyone they're losing as well. How is the medical community holding itself, according to you? And, what keeps you grounded these days, if I was to ask you?
So the people that are in training right now, they're in different departments, right? Like, I'm in internal medicine, so I deal with this kind of stuff all the time, just not the severity, but I deal with these types of diseases. But things like surgeons, they're not getting to go into the OR as often as possible to do routine and elective procedures. People that are gastroenterologists, they do colonoscopies and endoscopies and stuff just for screening measures. They're not getting to do that. So they've sort of been pulled into doing what I do on a daily basis. So I know from a training perspective, training, at least in these certain fields, are anywhere from 3 to 5 years. So these people aren't getting their level of training that they would normally get. So I can imagine it's taking a certain toll on them in terms of their confidence. There's certain people that are on the ending, that they're at the end of their training. So they might have to like move on and then not have completed the last 6-7 months of honing in their skills and, kind of doing all that stuff. And that's definitely affecting them. So, and I can't imagine the kind of mental, toll it's taken on people as well. There was a recent report that just came out that 2 physicians actually committed suicide. One was an emergency room doctor, and one was, I forget what they were, but another physician. And the report didn't say why, but they thought it was related to the stress of work. So there's definitely a wide range of people and their responses to how they're handling this. For me personally, what keeps me grounded is that I work in an environment with people that I really enjoy being around. I have a great, supportive, strong network. Me and my sister actually work in the same hospital, so I see her all the time. I'm actually sitting in her office right now. I don't have my own office. But so it's really cool to I can't see my friends. I can't see my family. But, I have my sister here with me. And we have a lot of camaraderie within the hospital amongst the staff, the nursing, nurses and my colleagues. So it feels really homey here. And so this is my family right now for this last few weeks.
We are coming to a close of this interview, but I have 2 questions left for you. My first question would be, what is your focus and some of your major concerns for the next few weeks? Professionals like you who still have to monitor what's happening with COVID, where are you focused the most on?
So my biggest concern for the next few weeks, I would have to say, is that once these social distancing orders are sort of loosened, people are going to think that it's okay to resume their normal lives prior to, the world of Corona. And I fear that this will lead to a sharp rise in the cases. And I anticipate that it's going to be far worse than probably like the initial crisis itself. And I don't think that at this time there's any projections of how that will be. But people have just been caged up for like 6-7 weeks, and then the minute you kind of like open up these bars and parks and all that stuff without any restrictions, people are going to just assume that they can go back to just living normal lives. And we don't know if we can respond to that. I'm just hoping that healthcare institutions and the government has prepared a plan B, plan C, plan D sort of situation. So that's kind of what I'm concerned about.
Definitely. Well, thank you so much for your time on ITV Gold. Just one last message to our audience. Maybe you can give us a couple of tips that they can, utilize in the coming weeks to just, work on their wellness, but also work on their health and safety. Over to you.
Sure. The first thing right now, even though certain states are thinking about like opening up, and I still continue to practice social distancing until the states do deem that it's, appropriate, but I would still use your own sort of thought process behind all of this as well. I would say to continue to provide love and support for those most important in your lives. Help out a stranger or neighbor in need. If they need to go to the supermarket and they're kind of on the older side, maybe help them out there. And most importantly, I would say stay hopeful, because without hope in crisis, there's really not much else we can do. I don't doubt that, we're going to get through all of this, and it's just a matter of time. So we got to keep our heads up high and our energy strong and see where we go.